Hi everyone, my name is Jessica Caruso and I'm presenting on behalf of my colleague Ludivine Veillette-Bourbeau. We are both research assistants in the Department of Sexology at Université du Québec à Montréal. I've been appointed to do this presentation today because apparently my English is better than hers, but please forward any question you have regarding this presentation to her. We'd like to thank CAR Conference for inviting us to present the results of an evaluation of the effects of the Phénix program. We have no conflicts of interest. So no, we're not here today to talk to you about how hard it was for employees of the federal government to get paid, but about Phénix, which is a community-based research project carried out by a team comprised of researchers and members of community groups involved in the fight against HIV. Phénix is a group intervention program for GB-MSM that combines the adoption and maintenance of HIV and STI risk reduction strategies without compromising sexual well-being. The program was developed and evaluated in 2006 by a research team in the Department of Sexology at UQAM, which included Martin Blais and Joanne Otis. After the study ended, community groups in Montreal continued to offer the program. Also, Phénix was adapted culturally to be delivered in Ontario and Burkina Faso, and a version was developed for seropositive GB-MSM. Over time, the program needed to be updated since the main prevention strategy it proposed was condom use and its tools were outdated. In addition, some community groups asked for a version that could be delivered one-on-one. So a new community-based research project was funded by CIHR and launched in 2015. The goal was to revise the program so it would better reflect new advances in HIV prevention from a perspective of combination HIV prevention and to perform a thorough evaluation of its effectiveness as well as its implementation and sustainability conditions. A broad consultation with members of the community and key informants enabled us to completely review the program. The new program was implemented from 2016 to 2018 in 10 sites across Quebec in group settings as well as in one-on-one, in-person, and online. The goal of the Phénix program is to get participants to develop and implement an action plan to improve their sexual well-being by integrating sexual skills and risk reduction strategies adapted to their preferences, ideals, and the context of their sexual activities. The program is based on three key concepts: eroticism, which refers to activities that involve stimulation of erogenous zones likely to cause sexual arousal and lead to orgasm; risk reduction strategies, or strategies that can reduce risk-taking; and sexual well-being, which suggests physical and psychological satisfaction related to sexual life and overall feelings of content. The program involves 6 3-hour workshops with a 3-week break to give participants time to implement their action plans. As you can see, the workshops are usually divided into 4 parts. Around 15 themes are addressed in Phénix, such as comprehensive view of sexuality, STBBIs, disclosure of serological status, and risk reduction strategies. Participants are prompted to discover their tolerance levels related to sexual risk, to identify elements that make them vulnerable to risk-taking, and to dissect in detail a situation in the past where they took risks. Around 15 erotic skills are addressed, including breathing, pelvic tilt, sensual massage, oral sex, rimming, and anal massage. Those skills are discussed during the workshops, supported by erotic educational videos developed specifically for the program. So on screen, you can see an excerpt of the genital massage video starring a Montreal porn star and a life-size sex toy. This is what's special about Phénix, the concept of combination. So we use a combination HIV prevention approach, but we also encourage participants to combine their risk reduction strategies with the erotic skills they will develop during the program. This is one of the reasons why we created the Phénix game. The way it works is inspired by the game Cards Against Humanity. So the facilitator picks a card that describes a context where a sexual relation could happen. Then participants combine at least one erotic skill like kissing or rimming with at least 2 risk reduction strategies like taking PrEP or serosorting. Of the 21 strategies available, some are more effective than others, and once a card is played, it can be played again. This forces participants to explore new combinations and think outside obvious or usual combinations. When participants learn during the program, will ultimately enable them to build personalized action plans designed to improve their sexual well-being. This presentation focuses on the effects of the Phénix program. The program was evaluated using a pre-experimental design, pre- and post-exposure with no control group. Participants were asked to complete a questionnaire before the program as well as a month and 6 months after the program has ended. Questions were about socio-demographic profile, LGBTQ2+ community connectedness and empowerment, sexual well-being, socio-sexual profile, and use of risk reduction strategies. Questions were added at post-test to evaluate the program. Differences in scores between times of measurement were tested using generalized estimating equation autoregressive models. The effects were controlled for certain sociodemographic characteristics such as age, sexual orientation, and ethnicity, as well as implementation characteristics such as exposure to the program, program format, and site of implementation. A total of 81 GB-MSM participated in the program. Participants were aged 21 to 69 years, with an average of 46 years. Just over half the participants had university degrees, annual incomes of 40,000 or more, and were born in Quebec. Most identified as cisgender men and gay. Only a quarter of participants were in relationships at program onset. In terms of HIV status, 73% were seronegative, 25% seropositive, and 2% did not know their status. All HIV-positive participants had undetectable viral loads and had been living with HIV for 10 years on average. To control each participant's exposure to the program, an implementation score was calculated by evaluating the degree to which the program was implemented as planned. The degree of implementation was near a perfect score, with an average of 1.8. Of the 81 participants, 47 were in the group program and 34 in the one-on-one program. 5 participants had previously attended an earlier version of the program. The program was offered at different sites by facilitators trained by the research team. The sites included community-based organizations, sexual health clinics, and rooms at the university. Baseline and post-test comparisons suggest a significant improvement on several key psychosocial variables: empowerment, intention to use risk reduction strategies, sexual satisfaction, self-assertiveness, self-esteem, self-efficacy and control, motivation in self-care and risk avoidance, and perceived control over risk avoidance. Follow-up data suggests improvement maintenance for all variables except the 3 that are not in bold. We also observed a significant decrease in 6 barriers to use HIV risk reduction strategy: quest for intimacy, eroticism interference, condom availability, assumed partner serostatus, safer sex fatigue, and sexual compulsivity. Follow-up data also suggests maintenance for all barriers except for 1. Phénix is a promising intervention program in improving sexual well-being and sexual health among GB-MSM. Significant improvements in a number of key sexual and psychological health variables are not negligible within the perspective of the HIV syndemic, where action must be taken on several determinants of overall health to have an impact on HIV risks. Phénix has shown positive effects on key variables regarding adoption of HIV prevention strategies. However, its direct effects on reduction of at-risk behaviors and HIV incidence remains to be established. This study has methodological limitations. It has a small sample size and absence of a control group. A selection bias related to participant motivation for the program is also probable. The sample also included a high proportion of men who took few risks. Therefore, results cannot be generalized to GBMSM in general, nor to those who take more risks. Following the implementation analysis, we made changes to improve the program and address the gaps identified by participants and facilitators. Some themes were added, and the program now includes 8 workshops. A website will be online in the fall of 2020. The program will be available for free in French and English. For more results on the evaluation of the program, check out our online poster. Thank you for your attention and have a great virtual conference.